Hello and welcome to our Facebook Live series at Bone and Joint Institute. I'm Lindsay and this is Dr. Preet Gurusamy. And today we are going to be talking about joint replacement, in particular knee replacement. And we're going to answer some questions and ask and answer some questions with Dr. Gurusamy. But before we get started with that, Dr. Gurusamy, give us a little intro on yourself and your specialty.
Okay. I'm Preet Gurusamy, grew up in Texas. I've kind of been all over for my training, but by subspecialty trade, I am a specialist in hip and knee replacement specifically, but more generally, I take care of anything related to hip and knee pain. Hip and knee replacement is just kind of part of that. I've been here now for a couple years and loving it.
And your clinics are here in Franklin and then also down in our Spring Hill clinic on Thursdays, correct?
That's right. Clinic up here is Thursday, Spring Hill, and a brand new clinic, and which is going great. PT in that office. So.
Awesome. Well, today we're talking about joint replacement, knee replacement, and but before we really get into surgery, let's talk about arthritis in general. What is arthritis?
Yeah. So arthritis. Basically, if you think about it, what it is physically, it's the degeneration of the knee joint and the loss of cartilage within the knee joint. And arthritis kind of comes in different flavors. There's inflammatory arthritis, which is caused by an autoimmune condition where your body attacks its own cartilage. And that's rare, but there are certainly medications that can help treat that. There's also post-traumatic arthritis, which we think about if you're an athlete and you tore your ACL. Well, you didn't just tear your ACL, you probably had some damage done to that joint. And that wear and tear that develops over time is post-traumatic arthritis. And then there's the flavor of arthritis that the vast majority of people develop, which is osteoarthritis. And that's age-related, but also mostly governed by genetics. And that's kind of the slow progressive degeneration of joints, the loss of cartilage, which leads to stiff and painful knees.
Okay. So what non-surgical treatments do we have for arthritis, or what do you try first?
Yeah. So surgery is never the first treatment choice. For any patient who's struggling with arthritis, we always want to explore non-surgical treatment options. So probably starting with the most conservative options, the least invasive options, staying active, being strong, maintaining your quadriceps, your hamstrings, doing low impact exercise like cycling, swimming, Pilates, yoga, elliptical, rowing. All of those are great for patients with knee arthritis. The other thing to consider is any amount of weight loss that a patient undergoes is extremely helpful for knees that are arthritic. So that's kind of the most important thing for non-surgical treatment. The next step up in terms of, I'd say, invasive treatments would be injections, which we do here, which I routinely do at my clinic in both Spring Hill and here in Franklin, which is cortisone injections. There's also different types of injections called viscosupplementation, or some people call it a gel injection. They used to call it a rooster comb injection because it was brought from the rooster comb. Now we do a synthetic version of that, but kind of the same thing, hyaluronic acid. So injections are there, and that kind of makes up a lot of treatment, and a lot of patients get a lot of good results out of that.
Okay. So once you've tried some conservative options and we think we're ready for surgery, when do you have that conversation, or what makes you go to the surgical option?
Yeah, so there's two things we really look at. One is x-rays or advanced imaging like an MRI, and we look at what's really happened to the joint. So this common saying we hear is bone on bone, which basically means that the femur and the tibia are now rubbing up against each other because there's no cartilage in there. So bone on bone. So an x-ray that shows bone on bone, that's part of the picture, but that's not the most important thing. The most important thing is pain. And pain, debilitating pain where you as a person can't do the things you want to do,
Got it. Okay.
that's when surgery has a role. When you've tried weight loss, when you've tried conservative treatments, you've tried injections, you still have pain that prevents you from leading a life that you want to, that's when surgery is the best option.
Okay. And are there different types of knee replacement that you do? So do you replace all of the parts of the knee versus some? Can you talk a little bit briefly about that?
So there are there are partial knee replacements and total knee replacements. And partial knee replacements in my practice and in America as a whole probably make up 10 to 15% of all knee replacements done. And the reason is, oftentimes most patients globally, their whole knee's worn out and they need a total knee replacement. Now, for a select few patients and patients with arthritis that's specifically in one part of the knee, a partial knee replacement does make more sense. And the reason there's a benefit there is because partial knee replacements are surgery that's not as extensive. You keep some of your same ligaments, and so the knee tends to feel a little bit more natural. Downtime is a little bit less, and recovery is a little bit easier. So for very active patients who want to let's say play pickleball, but just have one area of their knee that's degenerative, a partial knee replacement could be a great option.
Okay, and then talk about the total knee replacement. What does that involve? And is that something that you're in the hospital a long time for? Talk about that.
The vast majority of total knee replacements that I do go home the same day.
Wow, that's awesome.
Yeah, and a lot of that has to do with recovery, anesthesia. We've transitioned to spinal anesthesia. Patients are getting nerve blocks. We just know how to handle pain a lot better now than we did 10, 15 years ago. We get you up walking immediately after surgery. We know that's kind of key to recovery. Getting you up and walking, that really does help with recovery. So again, most patients go home the same day. Occasionally, there's a reason to keep a patient in the hospital if you have a serious cardiac condition or something that we just want to keep an eye on occasionally. And that's definitely an option. We'll keep you overnight, but most patients can go home the same day.
Okay, wonderful. And then after surgery, physical therapy, how important is physical therapy in the recovery process from a knee replacement?
Physical therapy is probably post-surgery the most important thing in terms of patients getting a satisfactory knee replacement. That's one of the big things at Bone and Joint that I love. We have all our different locations, Spring Hill, that PT office just down the hall, and I know these physical therapists and I see their notes. They know they have our very specific protocol, so I obviously love that we have that in-house. And the difference between patients who love their knee replacement and those patients who just didn't quite meet their expectations often is how well physical therapy went.
Okay, wow. So talk a little bit, we'll kind of go back a little bit more, but how do you can you prevent arthritis? I know you talked a little bit about weight loss to hopefully decrease pain, but is there anything that we can do or take or eat that could prevent it?
The best thing we can do is stay active, healthy, stay in a healthy weight, and maintain our strength. Do some sort of resistance training to keep the muscles in our legs healthy, and stay active. And that probably is the most important thing we can do to prevent arthritis. A lot of arthritis, we're figuring out, is guided by genetics, which obviously we don't have a lot of control over. There's hundreds of different genes that probably play a role in it. I think a common misconception is, well, if I run often, I'm going to wear out my knees. But we know that to not be true. There's marathon runners who have great knees going into their 70s and 80s. And there's people or patients who aren't that active who develop very debilitating arthritis. And the reality is, it really is guided by genetics. But what we can do to make sure that when arthritis comes, that we're able to still be active, is to stay within a healthy weight and be strong and stay active.
Okay, wonderful. Well, Dr. Gurusamy, thank you for all of that information. It was so helpful, and we hope that those of you that are following along online got some good tips along the way and some good information. Now, one question that we ask with every one of these Facebook Lives is, and you kind of touched upon the PT piece, but talk about the comprehensive care that Bone and Joint Institute offers here as a whole practice.
Yeah, I think, we kind of are soup to nuts in terms of care of knee arthritis. I mean, you come in initially, we'll start with conservative treatment, whether that's bracing. We have our medical equipment group in-house that we can get you fitted for a brace that day. We can do an injection that day. We can get you into physical therapy. That's all within the house. And then obviously if you end up needing surgery, oftentimes joint replacement's done here in our surgery center. In our surgery center. So, and post-op visits are obviously in this clinic. So we kind of, every single stage of arthritis we can kind of take care of, and it's all together in one place. Obviously that's a lot easier for you. It's a lot easier for me as a physician to be plugged into these different parts of your care.
Wonderful. Well, again, thank you for your time today. We really appreciate it. And for any questions or to schedule an appointment with Dr. Gurusamy, you can give us a call at 615-791-2630 or check out our website, boneandjointtn.org. Again, thank you for your time today, and we'll see you next month. Thank you.